years old female sleeps on wet floor, injuring her ankle. On examination, she has tenderness over the lateral malleolus and medial malleolus also. And X-ray demonstrates there is an undisplayed fracture of the distal fibula and is at the level of the syndesmosis and the congruent ankle mortis. What is the most appropriate management? Here the options are application of full leg cast, surgical fixation, application of below knee walking foot, application of extensor fixator, and bed rest and splinting, and also traction. So what may be the option? So again, see, there is a tenderness over the medial and lateral malleolus, but there is the fracture in the distal fibula, that means in the lateral malleolus, but which is the undisplayed and which is at the level of the syndesmosis. So all of the points are important. So first of all, let's see the fracture which occurs at the level of the ankle joint classification. So first of all, let's see, this is a Weber classification of the ankle joint fracture, and there are three important classification or three important part. One is the Weber A, Weber B, and Weber C. The Weber A, it is located, and at this point it is the syndesmosis point, or this is the joining point of the tibia and fibula. This is the fibrous joint between the tibia and fibula, and it is known as the syndesmosis. So when the fracture is at the level of the syndesmosis, it is known as the Weber type B, and when below the syndesmosis, it is the Weber A, and when above the syndesmosis, it is the Weber C. So it is the Weber classification of a ankle joint fracture. Now see, this is the Weber classification. In case of type A type of fracture, it occurs the below the level of the syndesmosis, and in case of B, it occurs at the level of the syndesmosis, and type C, it is above the level of the syndesmosis. So when there is below, there is type A, when there is above, type C, and when at the level of the syndesmosis, then it is the type B. And here we can see the management of Weber type A, B, and C. In case of Weber type A, it is the most lower part, and in this condition, ankle boot is an up. And in case of Weber type C, which is the above the level of the syndesmosis, and their only operating option, only treatment option, which is the operative fixation. So in case of Weber type A, which is below the syndesmosis, it is by the ankle boot, and when above the syndesmosis, which is Weber type C, and there is operative fixation. And in case of Weber type B, there is two options. One is the operative option, another one is the ankle boot. So when there is the undisplaced fracture, that means no displaced. So in case of non-displaced fracture, or in case of slight fracture or minimum fracture, there is ankle boot. And when there is operative fixation, when there is displacement, or when there is more than one bone fracture occur, in this condition, go for the operative fixation. So what is in the question? We have to go for application of the below knee walking foot. Why? Because here we can see X-ray demonstrates there is the undisplaced fracture of the distal fibula, and it is the at the level of the syndesmosis. That means it is Weber type of the B. And in case of Weber B, there is two options of treatment. One of them is ankle boot, and another one is the operation. And as there is undisplaced fracture, as this is the undisplaced, in this condition, we have to go for the application of the below knee walking boot. It is enough. But if displaced occur, in that condition, we should go the operative procedure.